And Ms. Haag is in the operating theatre or is going to present the next case, not in the operating theatre, of course. We have a 77-year-old male patient with solitary hepatocellular carcinoma, and we found a 4 centimeter stage BCLC-A mass lesion. In the EUS, we see a hypervascularization but no washout phenomenon, and we believe that this is indicative of hepatocellular carcinoma. What kind of therapy would you suggest, Dr. Fischbach? Well, first and foremost, I would like to extend a cordial welcome to our audience, and I would like to introduce Ms. Ritter, who will assist me during this intervention. We're going to do a CT. The CT was carried out after the sonographic visualization, and we see that there is an avascular finding, and you see it in the arterial phase. It's been marked with a red arrow. The interpreter is sorry, there seems to be a technical glitch. In the portal venous phase, in the CT, we see a certain washout phenomenon, but it seems to be limited to that capsule, and the image correlates very well with the ultrasound image, and we believe that this is HCC. In the lower image, you see the coronary view of the liver, and you see that we have a nodular surface because of the long-term cirrhosis, and in angiography we have a reconstruction of the vascularization, and you see that the right hepatic artery is pointing towards the liver, and those small white spots are stones in the gallbladder, and above we see the left hepatic artery. There seems to be a collateral towards the left vascular area, towards the perfusion territory. Your interpreter is very sorry, but the sound keeps cutting out. I'll try to interpret as much as possible, and now the chair has said that unfortunately we cannot hear him, the audience can't hear him either, so there are dropouts. Don't move around please, now we can't hear him at all. It's even worse, you have to move. And now we can hear you. You have to move. My microphone is on the left side. Or you can just take off your Halloween mask. Yes, but if I do that, then there will be discussions concerning hygiene in angiography. Is it better like this? Yes. Okay, then I'll try not to move anymore. We're going to do a transarterial chemoembolization, and the target vessel is the right hepatic artery, and we'll approach it from the superior mesenteric artery. And we are going to use a 4 French system as a port. Maybe I can show it to you. And the catheter will be introduced in the vascular system of the patient. The catheter is in the aorta above the celiac trunk. Can we just get a close-up? That's the catheter, and the sound's gone. Your interpreter is very sorry. So the image is without any color, he seems to be saying, and I can control the catheter in order to get into the superior mesenteric artery or the celiac trunk. I'm going to do that under X-ray guidance. Can you show us the X-ray? Control, please show us the X-ray. There it is. I think you can see the catheter at the height of the lumbar spine, and it's the lumbar vertebra number 1. Please hold your breath for a moment. And we can go through the images one by one. We've just captured a series. Here you see that the anatomy is quite interesting. I'm moving the catheter close to the celiac trunk and I'm in a very strong side vessel. It's the inferior phrenic artery. And I have to circumvent it somehow because that's not my target. Let's have another look at the image. Hold your breath. Once again, sorry. We seem to have technical problems with the sound. It's very difficult to hear the surgeon. Celiac trunk, he seems to be saying. You see the common hepatic artery and the gastroduodenal artery and also the left hepatic artery, and at the top you see the branches of the left liver lobe, and then you see the vessels going into the right hepatic artery. I have a catheter now, which I can introduce into the guiding catheter. There is a micro wire, I hope you can see it. I'm going to bend it a little. You see that it's bent now, and we introduce it over this 4 French catheter system. Let's save the reference image, please. Okay, reference image has been saved. Now the angiographic image. We are generating an overlay image now, overlay 53%. And this gives you an idea of the entire vessel system. And you see that the microcatheter is now flowing into the hepatic artery. I hope that talking will actually get it into the liver artery, into the hepatic artery. We're now in the gastroduodenal artery. Now it's gone to the left, fortunately. Now let's have a look. I'm going to magnify now the image in order to check the positioning of the catheter. The catheter has unfortunately started slipping a little, but we are now to the main artery, and I'm trying to get down again through the collateral into the right hepatic artery. Maybe we can just go through the entire series. Okay. I've gone a little too far now. Hold your breath. This is where I have to take a turn, as it were. I've just created another series of images I can use. And I'm going to continue with the micro catheter and the micro wire. The saved images can be used in an overlay and can be superimposed onto the X-ray image. And when the catheter will hopefully move in the right direction. It's a little bit more difficult than I thought because the vessels are very tortuous and there is a lot of pretension. I've applied a bit of force. Now we're going to pull out the wire. Unfortunately, you have to create enough space for the application of contrast. Hold your breath. I'm going to take another series of images. And this gives you an idea where there is accumulation of contrast agents. So let's go through the series of pictures we've just taken. So I think we have to go cranially, we have to go caudally, and you see these little vessels. So we will do an embolization with drug-eluting particles. Do I have more time? Yeah, just continue, and we're not going to continue watching, but we will switch back to your operating theatre later to show us the results of his intervention. Mr. Fischbach.
Einen Schritt weiter und
yeah, right. So we got one step further, and now we are in the caudally directed vessel here with our microcatheter. So here you can see that. So actually I focused on the strong vessel here originally, but here you can't really see a nice contrast vis-a-vis the tumor. But then that's typical for a life case, isn't it? Then all of a sudden here you see the cranial vessel here, a corkscrew style vessel, and from here you can then visualize the tumor. So apparently that's not going to get easy. Well, obviously, I mean, we now have the impression, we got the right impression that you really have to be able to fiddle around as radiologists as well a little bit and be a bit patient with these things. And now,